public health professionals I know and the work that public health does has really, in many places, in many regards, faded into the woodwork. And I think it's reflected in the fact that the funding for public health is low, and it's low in Kansas. But it's an event like this where we have to flex up with the pandemic. It's important that this happens at the local level first and foremost. The job of the state agency, KDHE for this instance, is to support the local health departments and then work together, because nothing happens in just one county. But I want to make it very clear that my role is the field commander, and the work being done is by the foot soldiers out there. It's up and down the line. My own agency, yes, other state agencies, and certainly the local health departments. I think about my military uniform, my Army uniform. I've got all these ribbons, but the one that's over on the other side, separate from all the rest, is a unit award. This award is a unit award. We've learned during this that perfection is not possible, and certain concessions have to be made, and that requires negotiation. Kansas is such a diverse state that having unanimity of opinion is not easy. Urban and rural opinions are not the same, and one of the things that I think we've done a good job with is consistency of message, having it be fact-based, science-based. And one of the very first things we did was started populating our what eventually became called the COVID-19 microsite. And it is a living, breathing document. We change it every day, something that policymakers and schools and higher education and others really have come to rely upon. So I think that one of the things we do really well is to put some organization around it so everybody is pulling the same direction. Certain populations are at higher risk, and we've seen that, and you've seen that play out with nursing homes, prisons, essential workers who find themselves with COVID-19 patients all the time, people that are in close approximation, and then the racial and ethnic minorities and low-income people. And it's really important to identify those populations and make a special effort to reach out to and be invited into those populations to have impact to protect them also. So we try to customize our effort both in terms of messaging and in terms of testing, and then management of the people who become infected, because everybody responds differently to this virus. This is not a routine problem. Routine problems can be handled through routine problem-solving mechanisms. This is a novel problem. Remember, early on in this, it was called the novel coronavirus, and it's turned into a novel response.